Welcome to the podcast Living Well. This is a podcast that deals with issues related to chronic pain, good quality of life, palliative care, end of life care. So today we have someone who's very interesting. Her name is Mrs. Balaka. I know her for
10 years.
about 10 years now. She's been one of those very important figures in the world of women's pelvic pain. And it's an interesting phase. Now, when we talk about women's pelvic pain, and I'd like you to just start off with the journey so that, our audience can understand what I'm talking about here.
Yeah, so my journey started with interstitial cystitis, as you are aware of. The thing is, interstitial cystitis, people think it is only bladder pain. But many people, including not now, but initially when we started, even doctors used to miss out on the pelvic pain part. So for the patient, it was always like my bladder is paining, my bladder is paining, my bladder is paining, but it was never like it could be something related to pelvic floor dysfunction. And even now, even after 10 years of this awareness campaign that we are doing and all, even now after 10 years, we see that many patients, they are not aware of the pelvic pain part. So this has been like an interesting journey, because now some patients and some doctors, they now have started recognizing this pelvic pain part. So now pelvic pain therapy, PFT, these things have started. But still I see this pain part. Interesting thing is, patients, whenever they have this problem, they only want to go to the urologist. They never want to go to a pain therapist.
So I'm going to stop you over there. Now, you mentioned something called interstitial cystitis. So someone who's listening to the podcast may not even know what is this topic. So let us go back to, say, someone who's diagnosed. What would have been the story of a woman or a man? Maybe, and I'd like to talk about the woman's aspect first. 15 years ago, they have a condition called interstitial cystitis. And let's listen to her and understand what would be the symptoms and what would be their problems.
Okay, so the symptom is very similar to UTI.
That's a urine infection.
That's a urinary tract infection. So what happens? Mostly it is like chronic UTI, recurrent UTI. So patients, they start getting this urine related problems like frequency, urgency.
So the
pain,
interesting part
burning.
is she's been doing this for so long that now she's talking like a doctor, and she's not a doctor, and she's using all the technical terms like frequency, urgency. तो यार आम आदमी हमारे जैसे जो डॉक्टर नहीं है उनके लिए जरा बताइए.
Okay. So let me start with my story. When I was getting my symptoms, when we were getting my symptoms, so I was always going to my gynecologist, and she was saying, you have UTI. She used to give me some medicine. I come back again after a month or so. I was going back with the same problem.
मतलब commonly urine में burning होता है.
burning frequency बहुत बार I had to go, like I was going, I think initially I used to go almost 30 times a day. My frequency was such. And then whenever I used to feel this urgency to urinate, there used to be a pain, and I had to like immediately urinate, because I couldn't hold it. I have to go immediately. So traveling, and I love to travel. So traveling became an issue. Going anywhere became family functions I used to skip, because I was worried ki washroom hoga ki nahi. Journeys became difficult. Office jana became difficult.
So I'll just hold. So this is not a problem just for interstitial cystitis. Generally, when you're traveling with women and families, one of the first concerns is whether there'll be good washrooms and how friendly are we to these arrangements for our society people.
So washroom, even now, I think in India, not only India, I think anywhere washroom is still an issue. Because in India also, like now still I think it's little better, but even if you're going for road trips and all, it's always a nightmare. Yeah, and then diapers and all, you don't feel like wearing. Maybe you don't feel like wearing. These days they have also come up with those urine pouches and all.
This is interesting. We should talk about it. I didn't know this. So
yeah, now they have those urine pouches for travel friendly. When you go, you can just take them. You can urinate and void in that, and then you just throw it. So there is this thing, but I have personally never used it. So I'm not sure how comfortable it is,
that would, yeah.
but it is there. There is an option now at least. So yeah, so I used to go to the doctor, and then finally I got diagnosed, and I was told that I have this thing called interstitial cystitis. And trust me, at that time, like this was around 2014, 13, 14. Back then, I thought I was the only patient with this disease in India. I couldn't find another patient. In fact, doctors were also like, many doctors were like, I had read this somewhere during my when I was doing my MBBS, but it was like a MCQ type thing, so we skipped it. This is a true story. I had gone for a 1 mg doctors ka conference, and there were like so many doctors. I asked them, do you know about this? One guy said, I remember, ये मेरा एक MCQ था.
Friends, if you go to a doctor and like come to us, and if we tell you that this was an MCQ, I think you should look for a doctor who didn't do that as an MCQ question. What happened after that?
So that was the thing. So this was the level of awareness at that time. So I thought I was the only patient, and then I connected to few patients abroad and all that. But then gradually I started this group, and now we have around 1,000 patients, and in my group, registered patients are 221.
So let us talk a little more about the group. So the first part is कि पहले आपको problems हो रहे थे. It was difficult for you to pass urine, and it was painful. And when we ask about pain, वो pain थोड़ा रहता था कि बहुत severe रहता था?
See, IC has flares. So you know this. So flare, when like normally when there is no flare, the pain level is say 1 or 2. But when there is pain, some days I used to feel the pain level is 11, like out of 10. So it was as severe as that.
So it's not a fixed kind of pain. It fluctuates, and the pain can be very low or it can be extremely high also.
So that is how then I started this group. Now the problem that my patients face.
One second. Again, I'm interrupting you. My question is, ये group start करने के पीछे, once you started doing that, you had the problem, you were diagnosed. But when did you know confirmed कि this is interstitial cystitis? It's a rare condition where the urinary bladder gets problems. आपको पता कैसे चला? How was this confirmed?
So there are few tests, but actually interstitial cystitis is a diagnosis of elimination. So what the doctors do, they eliminate other conditions, that it is not carcinoma.
तो ये नहीं है, cancer नहीं है, वो नहीं है,
cancer नहीं है,
इसीलिए ये है.
TB. Initially, actually, they used to think this is tuberculosis also, because tuberculosis is more common in India. So this is a process of elimination. So nowadays, what they do, they go for cystoscopy. That is one test.
They check the urinary bladder.
They do the cystoscopy. Okay. And then they also do urodynamics test. So it depends on the doctor also. Yeah. The general protocol is cystoscopy, but some doctors, they do it with urodynamics also.
So your diagnosis, just I wanted to understand that 10 years ago, 15 years ago roughly, how much time would it take for someone, say, to get a diagnosis of interstitial cystitis?
Yes, that is where I'm coming to. That is the most interesting question, because misdiagnosis is, I think, almost 80%. That is the problem, because what happens, because the awareness level is so low, most doctors also, they don't initially think of IC. So they keep on treating for UTI, for men it is like prostate issues, they keep on treating. So IC diagnosis takes time, and this is a common joke among IC patients globally, that it is the 5th doctor who will diagnose you, because first 4 doctors will fail.
Yeah, because 4 MCQs, no, A, B, C, D, and so, none of the above.
Finally, the 5th doctor will diagnose you. Even now, like even couple of days back, few patients joined my group, and they are also facing the same problem. They went to 4-5 doctors, and everybody was like, someone was giving them antibiotics, someone was giving them something else, and then finally it was like, this is IC.
But is it because they don't go directly to urologist, or first they go to gynecologist, or what usually happens for women?
Yes, for women, what happens is they usually go to a gynecologist, and the awareness level now, thankfully, it is better. But earlier, 10 years, 15 years back, among gynecologists, the level of awareness was very low. So that was because women used to go from one doctor to other. And among men also, many usually go to their general physician, or they go to maybe one urologist, diagnosis nahi hota hai, then they go to other. So it usually, mostly it takes time. It is, I have not seen, like I would say, not even a single patient who has gone to one doctor and wahi ka wahi diagnosis ho gaya. So that is one thing. And now I'm coming to the pain part. What happens? Urologists are treating, but IC is a disease that needs a team of doctors. You cannot treat IC with only one doctor. So you need a dietitian, you need a urologist, you need a pelvic pain specialist, you need the pelvic floor therapist. So you need, and also psychotherapist, because because it's a chronic condition, depression level becomes very high, and there is a lot of anxiety among patients and a lot of denial also. So but the thing is, most patients, they don't want to go to a pain therapist, they don't want to go to a psychotherapist.
But again, it's the approach. Any medical illness in India or over across the world where you need more than one doctor to treat, the general mentality is, oh, I'm going to go to 10 people I'm going to spend. But usually the truth is that some complex conditions need teamwork, and we cannot function without teams nowadays. So let's go back to the phase when you were in the diagnosis phase. The diagnosis was given to you, and what was your reaction when and your family? What was the reaction when they told you that this is a rare condition, and it has it's we don't know so much about it. हमने MCQ में छोड़ा था. What was your reaction about?
Initially, of course, it was very frustrating, and especially when I was reading on Google that this is incurable. The pain gets so bad that it's worse than cancer pain. So these things were all over Google. So it was initially a little bit depressing, but at times I try to turn my poison into medicine. So what I did, I started researching, I started forming this group, I started interacting with doctors, I used to reach out to doctors, and then obviously I started reading up, and then I saw that this is a condition that can be managed, if not cured, and with good approach, with positive approach, with a good team of doctors. And I was very fortunate to have a good team of doctors. So that way, I think now I'm in a situation where I'm leading a normal life. And of course, the pain is there sometimes, but now it has become something like, at times I forget to register also.
Correct. So this is an example of empowerment where you are now in control of that pain. So most of us go through some aches and pains like back and neck, or some fortunate people may not have it at all, but many people have some conditions, but you are in control, and that pain is not affecting your life. Are you able to travel now?
Yes, I travel a lot now. I know, because this is diet impacts this condition, so I know which food to avoid. Correct. So I have my diet plan like that. हालांकि आजकल कभी कभी मैं खा लेती हूँ जो भी मन करे. So now the thing is, the pain is not controlling me, I am controlling the pain. I know, nice, and this is something I tell my patients also, whoever comes to my group, that the mindset is very important. And I remember you had told me long back that brain has a pain memory, something like this, that it stays in your memory. Yeah. So the more kind of feed it, it will. So that is what I tell my who comes to my group also, that it's, you have to control the pain, you have to control your diet, you have to know what are the conditions that will flare you up. So just control. So once you do that, and you just live your life, and you will be
in a relatively good space. So can you now tell me a little more about the group? You said a beautiful line. You said you have converted your poison into medicine. So what did you do? How did you channelize that, this group idea? How did this come across? Because groups in India usually are for complaining about, okay, the billing was too much, or this was happening, or just it's like a complaint center. But how can we turn that poison into medicine, even as a group, and use our strengths and grow as a group of people, as a society of people? What did you do?
See, the complaint part is still there.
It will be there, 100%.
It is there. There are still patients. Not Absolutely. Everyone has the same mindset. So somebody will look at it only for complaining. Others will take it very positively. They will research and all.
again, I want to, before I ask this, go into the detail of this group part. I feel that one of the reasons why people look also for a group to complain specifically is because I don't think they are being heard enough.
Yes, that is a complaint that doctors don't give time.
And what about families?
I'll come to that. That is interesting. Regarding
Doctors.
doctor, I just want to say one thing. I'll be the devil's advocate in this case, that for doctor also, they have to deal with so many patients in one day. So I understand that patients want to, go to a doctor's chamber and keep on talking about their problem. I understand that part, but they also have to understand that, so that is where I think therapy comes in place, that maybe whatever, because a lot of anxiety is not only because of the pain but also about all the thoughts that I'm not going to get cured. How will I live with this situation? How will I work? How will I travel? How will I go? How will I take care of my kids? So these things are there. So, and for doctors also, they are also trying. This is a condition that MCQ में छोड़ दिया था, तो अभी पढ़ना पड़ रहा है. So they also need to work on it. Yeah.
So if you have before we discuss the family part, since you have mentioned that doctors, one of the complaints is that doctors didn't give enough time. What would your message be to say the doctors?
Just be, one thing I want to request to doctors is just don't be dismissive. Because often, this is my personal experience, when I was in so much pain and all my reports were coming normal, because UTI का जो report होगा, urine report,
infection नहीं
कुछ नहीं है. So my doctor, she said me that, your pain is in your head. You're just imagining the pain. That, I think that was the trigger that I created this group. I have gone into advocacy. I have traveled to conferences and everything just to prove my point that it was not in my head. I actually had pain. That time I had pain.
So not being believed and
so,
not being...
And this often happens with most patients. When they go, doctors are like, your report is all clear, your USG report is fine, this is fine. Those who have Hunner's lesion, there is IC with Hunner's lesion, those patients, they get,
Bolo, Hunner's lesion and all that.
They get...
So she's using a lot of technical terms. So if urologist colleagues watching this, they'll be impressed at how much... now I'll also take a break. When we talk about doctors, there is an approach that patients Google karte hain, ya chat GPT. I actually like it, because that makes our job a lot easier. There's so much information and all we need to do is now filter it. Ready-made project बना दिया है, अब ये project को हमको थोड़ा सा fine tune करना है and we have the correct answers.
True.
So yeah, about the doctors and
so for them it gets diagnosed easily because वो दिखता है, but others का तो दिखता नहीं है. And then many doctors, they are like, no, you're just complaining, it's not there. And then the family also starts not believing them. They think कि डॉक्टर बोल रहा है तुमको कुछ नहीं है, तो तुमको कुछ नहीं है.
And a lot of these women who are young may find it a little more difficult, or if they're just married, and then there are so many other dynamics in society.
In India, if a young girl gets diagnosed, her first anxiety is, how will I get married? When a married woman gets diagnosed, her tension is like, this is a real story. I don't know if you want to keep it in the video or not, but this is a real story. One man, he met me. His wife was diagnosed with IC and she was in a lot of pain. And he asked me, Madam, ये ठीक होगा क्या? Then I said कि ठीक हो भी मतलब हो जाता है ऐसे. Then he said, छोड़ दूँ क्या इसको फिर? This is a true story. And I was like, what to tell him? Because for him, ये तो काम नहीं कर पा रही है, ये तो पूरा दिन लेटी पड़ी है, बच्चे हैं, घर में माँ बाप है. Indian family dynamics where a woman is often just...
So the societal role, and it's a more deep discussion actually.
Yes. So this happens. So the family has to be supportive.
What can the family do? What would your message be to the family members of a person who's diagnosed with, say, painful bladder, painful urination?
Be empathetic. Try to understand. Give her rest. Let her do, she will get better. And most women, they don't really want to be in this situation. They are also trying hard to come out. What you have to do is just hold her hand and let her just come out of it. So this is the place where the doctor and the family can play a very important role.
Support.
I was very fortunate that way. I had very good doctors. I had family was also very supportive, even though at that time my child was very small, but that was a big anxiety. But thankfully, because I had the support system, I could come out of it. But I know many women who are struggling, and many are in really bad situation because
Yeah, true. And then also to a certain extent in India, healthcare एक sort of privilege सा है जहाँ पे हम बात
True.
कर पा रहे हैं इसके बारे में, but ये इतना unseen and invisible चीज है. अगर if you see the length and breadth of the country, there are so many women out there in a smaller setting in a town where this is not known or acknowledged or understood. That can be extremely challenging. उनके लिए,
very challenging. And in fact, in India right now, the IC doctors are also very limited. We have
Limited.
only doctors in big hospitals, to be very honest.
Correct.
So patients who come from a little lower economical place, they find it very difficult to
Correct.
find good doctors, especially in remote areas. Like I have patients from Northeast, I have patients from interior Maharashtra. These patients, they are struggling to find a doctor. They cannot go to Bombay, Delhi. They cannot travel. So yeah, so those things are very challenging.
So there's a geographical challenge also कि access कैसे हो. So far we have spoken about how you started, and then you were told it's in your head, but then you did a lot of research. You had a team of doctors to help you. Pain, at least I can tell a lot of things that what we do in pain management. So urologists treat it. There are many things that we can do. Medications, like she said, pelvic floor exercises, which is done by a physiotherapist. So my skill is to do injections. So we do injections which are called pain blocks. So we do nerve blocks which reduce the pain. So there are many things that we can do to help IC patients. मतलब nerve को इंजेक्शन देके शांत कर देते हैं. तो बहुत सारे चीज हम कर सकते हैं. Coming to the next part of this group, this is one of the more interesting things I wanted to ask you. At that time, when you talk about advocacy in India, again, wherever there's advocacy, I'm interested because I want to know how people do it. How do they go out of their normal lives and talk about something for a group of people who they don't even know, but they want to do something for others? Very impressive. Please tell me about it.
Advocacy in India, people don't understand. When I tell people that I'm patient advocate, they think I'm a lawyer.
Advocate.
They think I'm a lawyer. They don't understand what is patient advocacy. So this is a challenge. But now I think it's changing bit because even there are many doctors, not only I'm not talking about IC, but in many other fields, doctors also want patient advocates to come and work because I think it makes their job also a bit easier.
Correct.
Because in my group, I can tell I take a lot of load from the doctors. Like the talking the patient wants to do with the doctor, they now can do in the group. Correct. So they come and they do. And advocacy work, I see a very positive thing happening in India. Many people are now aware of support groups, and people now want to come and join support groups. So they come, they talk, they know what to ask from a support group. Earlier they used to think I'm a doctor, they used to come and ask for medicines,
treatment.
Treatment. Now I have a strict rule in my group that I don't discuss any kind of treatment options or medicines. Those we don't. We are there to support you. If you need to get in touch with a particular doctor, at times we arrange that. If you need to some psychological support, those things we do.
Resources provided. So is this group like an offline thing, an online thing?
This is mostly online. Online. We did few workshops before lockdown. We organized a couple of workshops along with other doctors. So we do it like pelvic floor therapy. Once we did during lockdown, I think you remember we did a lot of Zoom meetings with the patients because at that time they were not getting access to any doctors. So we did that. But otherwise, it's mostly our WhatsApp group where patients.
It's a WhatsApp group. And mostly, so suppose someone, there's a young man, woman, old man, woman who's diagnosed with IC, and they are like, in the same situation. Am I the only patient in India who has IC? How do they find out about a support group, and how do they reach?
Now, thankfully, they don't have to think like that because now there are a lot of They go to Instagram, they go to YouTube, they go to Facebook, they find groups.
So there are more groups, right?
In fact, now there are too many groups. That's another challenge. This is the challenge that we are facing, is that now patients, they read so much. They go to ChatGPT, they go to Google, and there are numerous thousands of Facebook groups from various part of the world, even from India. I don't know if there are other groups or not. And the thing is, one thing is a lot of misinformation also, because not all groups are ethical also. I don't know if I should say this, but there are groups that just want to give some coaching. They give some they say that we are the only ones who got cured, so patients are going.
So this happens. I'll give an example. Like if you go to any hospital, especially cancer hospital, you'll see this. If you go there, there will be some people waiting there. They will ask you. They'll start a conversation and they'll ask, "What cancers? I know this place. It gets cured like this." And it's not usually a medical treatment. It's usually something that's unproven or even fraudulent. So that vulnerability to catch hold of, I have for a relative, I'll give you a story about someone who's waiting for a bypass surgery, and the wife is waiting downstairs for the billing section, and she's waiting in line. So she's sitting, and next to her someone comes and sits and says, "Your when is the surgery?" So she says so and so. He says, "Ha, even I wanted my relative to go for bypass surgery, but then I met this group and they told me that, and they are cured. If you want, I can give you the number." So here she's going to pay the bill for a bypass surgery, and at that time someone's talking about this. So this happens everywhere, I guess.
So this was not there 10 years back when I started. Now I see this a lot, because there are these American groups apparently who give courses for, I think, $300 or something like that, and they say that we will cure you.
But this is something I love about Indian patients. So we are so price sensitive and we are smart that way. So we know.
No, some patients went.
But to have one, you need two things. You need to be that vulnerable, or you need to have that level of money.
True.
Fortunately, whatever the economic standards are, people still are very sensitive about
so
it.
That happens. And then there are few groups who claim that this particular treatment will cure you, or this particular medicine. So there is a lot of things going on. That is also something now we have to deal with. But
so this is a darker side of the IC picture.
Not only IC, I think this is,
for
as
everything.
You said, because what happens, patients are very vulnerable. They need immediate cure. And with IC, to get better, you need time. A minimum 1 year you need.
Correct.
Minimum. So they don't want to do that, and then they don't want to do the hard work also, because when you have to heal yourself, you need to take care of your diet, you need to do maybe some exercises, you change your lifestyle, you change your stress level. So
when it comes to doing it's easier to say take this and you're going to get better rather than make that effort. It's true. Two questions, and you've been a great resource to help us out with a lot of questions for doctors and patients alike. The first question is very sensitive, related to a lot of men and women who have IC. One of the things that is taboo, जो इंडिया में बात ही नहीं करते, is sexual health.
Oh God.
Does it affect sexual health or no?
Yes, it does. It affects a lot, and actually any kind of intimacy can trigger your IC. And this is something that patients don't want to talk about. But this is important to talk. Even especially for young patients, it's difficult, and sometimes even contraceptives can flare you. So it's a very difficult, and then again, because of the taboo, patients don't want to talk about this. And one question I get very repeatedly asked from younger girls is that, can I get pregnant?
So it's not just the sexual, it's also that fear of whether they'll be able to get pregnant.
Yeah, can I get pregnant? Will it affect my child? These things, I said, IC doesn't impact your fertility or your pregnancy. In fact, during pregnancy, most patients, they feel better
with that.
So these are few questions. Recently, I was asked that, "Madam, I have to appear for a government ka kuch job, because I have IC, will I
that
get
be affected?
Yeah, I said no, it's not even, it shouldn't. Like your work, you may not be work because if it is like long hours and all that, but for examinations you're eligible.
Next question: how many doctors do you think are comfortable talking about the sexual health with, with patients, and how many patients are comfortable talking to their doctors about it?
I don't know about doctors because
I'll tell you this. Mostly, it's one of the last things on the menu. It's like pain. Okay, you have to go again and again to urinary. Yeah, sexual health is usually not ours. Is one of the things that I recommend to trainees at least is to incorporate this in a very sensitive manner with both the partners and discuss this, because it's a very important point of their natural life. They might have come to you, but if you don't know, everything else is okay. But if that is affected, again, it can lead to dissatisfaction, stress, and strain. So,
yes, for doctors they should, but patients also, I think not many are comfortable discussing. It's not only the doctors are not.
Correct.
Because I'm sure gynecologists, they are not uncomfortable discussing sexual health.
Correct.
But I think even patients, they don't want, and a lot of denial also in this.
Lot of denial. So I think it's a process, and even if not doctors, but at least if there is a sensitization, we can point them to the correct psychologist.
Yeah, I think this should start from school. Sorry, I think this should start from school level. All of you will remember in India, the human reproductive system wala chapter is always taught in half the class. Like 15 minutes, 30 minutes ka class hoga, to 15 minutes mein wo chapter ho gaya. They will discuss about pollination and all those things in detail. 2 to 3 classes they will take for pollination and all that. When it comes to human reproductive system, it's 15 minutes, half. They will finish that, they will go to the next chapter and something.
I like this. What is that? Like pollination pe do teen din laga denge, but 5 minutes they'll finish.
So and even in schools, like they don't discuss sexual health. Like my son is now a teenager. So I have to ask him, like, you are going, I think everything is in order. Like if you're going out, you should know what is happening. But schools don't want to discuss. So this is something, not only this is like later on you're coming to a doctor with a condition, but in school only, if this is made comfortable.
So it's basic awareness. It's not related to talking about sex. I think it's about India has that maturity that we have a huge philosophical background and history of knowing all these things, and how to knowing that helps at least to prevent diseases and a lot of other elements. So it's a great side point that we went into and explored, because it's connected to the topic here.
Even like I'm sure gynecologists will agree with this. I know so many patients, they go to the gynecologist with the mother-in-law or with their mother, but not the husband. Whereas I think when you're going to a gynecologist, you go with your partner. During your pregnancy, it's him who has to understand, but they go with their mother-in-law, because this is the mindset that we have.
Yeah, and there are so many other so there's so many social things that we need to work on also. But again, it's also about someone, there are different defined roles. Maybe this person's off to work, and it's understood. There are so many nuances, isn't Coming to the last part of the question, the podcast questioning is, if there is someone who's diagnosed with, say, a painful bladder today, a young girl, say you meet yourself, 2013, you have these symptoms, you're fond of traveling, you can't travel, you're wondering what's happening, and you meet someone and doctors, you're not getting an idea. If you meet yourself, what will your message be?
I don't want to meet myself.
Okay.
Maybe someone else. I would say that firstly, don't. There is so much noise around. Okay, that you're not getting cured, you'll not get better. There are no other patients. This is a rare condition. There is a lot of noise, but just focus. Focus on yourself. Focus on what you can do to make yourself better. What kind of things are giving you comfort? What is making you feel little better? Do that, and reach out to the right resources. Don't go haphazardly. Try to reach out to the right resources. And even, I'm very hopeful that in India now things are way
Much
better.
Yes.
There are doctors who understand.
There are societies.
There are societies. There are groups. There are a lot of resources available online. You just have to filter it out and see what works for you.
Correct.
And that is how you go forward.
So the correct order of doctors to see a gynecologist,
Yes.
a urologist,
yes,
a pain management doctor,
pelvic floor therapist.
pelvic floor therapist. If you're in a lot of emotional and distress, psychologist.
Yes.
Yes, and maybe definitely they need advocates who can guide them through the process, or have a group if they want to be in a group.
Yes.
If they're able to manage, fine.
And also not to, like, this is one thing, like, also become your own advocate. You know, don't need to wait for another advocate to come and do it for you. You can become your own advocate. You should learn to ask the right questions to your doctor, to whoever
Correct.
you're working with. You should, that also is very important. Yeah.
So we'll try and share some more resources on the channel and on our social media pages, so that will be easier.
Yeah.
And hopefully we can answer a few more questions there. And you've been a great sport. Thanks. It's a good conversation.
Thank you.
Quick question that I need to ask you, which we ask all the guests. So normally I do this podcast with my colleague, Dr. Smriti, and so we've done a few last year, and this year we're just trying to try different variations of this. But one consistent question which we ask all our interviewees is, what does living well mean to you?
Living well means to me that every day when I wake up in the morning, I don't dread the day. I look forward to the day and I'm happy about the day. It's not just I wake up and I start grumbling that, oh God, I have to do this. Oh God, this is there. It should be every day I should wake up and I feel this is a beautiful day and I'm going to make the best of it.
Beautiful. Thank you. Thanks for
Thank you so much.
joining us.